Hi, I'm Stemper. I'm presenting on Olecranon fractures. There's two different mechanisms of injury. You can either have direct trauma or indirect trauma. Direct trauma would just be a foolish falling on an outstretched hand, or just falling directly on the posterior tip of the elbow. Otherwise, you could have an indirect trauma, which would be an avulsion of the olecranon from the eccentric contraction of the triceps. Signs and symptoms are going to be extensive swelling, tenderness, ecchymosis. If it's a displaced fracture, there's going to be an obvious deformity, and oftentimes the patient is either going to be unwilling or unable to go into full extension. Your evaluation, you're going to want to assess the soft tissue around the elbow, doing neurological, circulatory screens as well. Range of motion and strength testing, you do not want to be extremely aggressive with if you believe there could be a fracture, because you don't want to compromise the fracture more. So you want to make sure that's ruled out before you really start stressing the area. And if you have an athlete who's presenting with unusual posterior pain and you can't find a significant result from an x-ray, they often recommend a CT scan to make sure that there's no stress fracture going on within the olecranon. I found a classification system. It's the Mayo classification. There's three types. All three types of fracture also have a subcategory of an A or a B. The A or B refers to whether it's a comminuted fracture or non-comminuted fracture. Type 1 is just going to be a non-displaced fracture. Type 2 is displaced but the ulnar humeral joint is still stable. And type 3 is displaced and you have an unstable joint. And one article found that for young throwing athletes that have elbow pain, you can decrease that pain by improving the strength in the rotator cuff and the scap stabilizers to help take some of the pressure off of the elbow as they're going through their throwing. For treatments, you can either do non-surgical or surgical. For the non-surgical, there's really not a lot of great research out there, but they're starting to look more into it and see if they can find a way to not have to do surgery all the time. In two different studies, one was splintered for about 4 weeks, and a 15-month follow-up, they had 67% of the patients were pain-free. And then a second study looked at using early active motion, and after 26 months, they had 12 out of 23 patients reporting that they were feeling good and pain-free throughout the day. And like I said, there really needs to be a lot more research in that area, because both these studies were using people who also had displaced fractures, so there was a lot of kind of complications with that. Surgically, there's two kind of main types of surgical fixation. You can either do a tension band wire, where you have two wires running into the bone, pulling the fracture back into place, basically. And then the fixation plate is where they just place a plate around the entire bottom part of the olecranon, sending screws or nails into it to hold it in place. For both of these, because the elbow does not have a lot of soft tissue and does not have a lot of adipose around it to provide kind of protection for it, hardware has to be removed depending upon the study, anywhere from 80 to 100% of the time, due to irritation, pain, discomfort, and other kind of problems that can occur. So if you have to have the surgery, you're most likely going to have a second surgery to have the hardware removed afterward as well. And for the fixation plate, they found that it's a lot more useful for people who have to rely on a lot of upper extremity strength or weight bearing. If they're using their arms a lot to prop themselves up or to get in and out of chairs, that one was shown to be a little bit more weight tolerant and being able to assist more and not fail as often. But that one also does, because it has the whole plate on the bottom of the bone, it also causes more discomfort if you're standing, sitting, leaning, and resting on the elbows. And those are just three pictures of the different types of